Hi everyone. Today I will be presenting a business review of clinical practice in the Cook Children's Medical Center Neonatal Intensive Care Unit. Cook Children's is located in Fort Worth in the Dallas-Fort Worth region. It is an urban, high acuity pediatric medical campus. The NICU is a level 4 unit, meaning that it provides the highest level of neonatal care and features a single patient room model designed to promote family centered care and reduce infection rates risks. The surrounding community is a large, fast growing metropolitan area with a significant cultural and economic diversity. Because Fort Worth has a high pediatric population and a large number of Medicaid insured families, there is substantial demand for specialized neonatal services. This environment shapes both the clinical load and the financial structure of NICU operations. So, this is a hospital based NICU practice that serves extremely prematured infants, medically complex infants, and newborns that require surgical, cardiac, neurological, metabolic interventions. As a regional referral center, Cook Children's receives infants from local delivery hospitals as well as facilities across North Texas. The NICU is staffed by neonatologists, neonatal nurse practitioners, registered nurses, respiratory therapists, dietitians, and lactation consultants. Additional support includes developmental therapists, pharmacists, and pediatric surgeons. Resources available include advanced ventilators, nitric oxide therapy, bedside imaging and neonatal transport teams, an advanced practice registered nurse employment contract typically includes 5 key elements: the scope of practice and clinical responsibilities, the compensation structure, benefits such as insurance, the expected schedule or shift requirements, and most importantly, in Texas, the required physician collaboration agreement. As an advanced practice registered nurse in this setting, responsibilities include daily rounding, performing neonatal procedures, conducting admissions and discharges, and documenting progress in the electronic health record. Shifts are commonly 12 hours, including nights and weekends, and the APRNs must adhere to the NICU's standards for documentation and quality. The average salary for a neonatal nurse practitioner in the Dallas-Fort Worth area is approximately $150,000 annually. Benefits typically include medical and dental insurance, retirement plans, malpractice coverage, and financial support for continuing education. Support for licensure renewals and specialty certification is also common. The practice is funded through a combination of Medicaid, Medicare, and private insurance reimbursement. Because Cook Children's is a nonprofit pediatric system, philanthropy and grants also support services. The hospital contracts with major insurers, including Aetna, Blue Cross Blue Shield, and United Healthcare. While NICU advanced practice registered nurses are salaried, it is important to understand reimbursement. For the procedure called 9923, Medicaid reimburses about $65. Medicare reimburses about $111, and private insurers like Blue Cross Blue Shield pay around $155. These reimbursement differences influence overall system revenue. If we consider a sample day consisting of 3 new evaluations and 5 follow-up visits, the total reimbursement will vary depending on the payer. For example, Medicaid would generate around $370, Medicare around $783, and Blue Cross Blue Shield roughly $1,065. The typical neonatal nurse practitioner salary is approximately $150,000. When benefit malpractice insurance and administrative overhead are included, the total annual cost for the organization is estimated at $232,000. This helps the institution to balance staffing needs with financial sustainability. In Texas, advanced practice registered nurses are legally required to practice under a physician delegation. This means a neonatologist must be designated as the collaborating physician. The agreement includes prescription authority, chart review, expectation, and quality focus meetings. Texas does not allow full independence practice. To practice in the NICU, the advanced practice registered nurse must follow a written protocol that outlines clinical standards. This includes ventilator management, airway procedures, feeding and neck prevention protocols. NEC stands for necrotizing enterocolitis, central line care, and neonatal resuscitation. These protocols ensure safe, consistent care that are in alignment with hospital policy. The effectiveness of APR in practice is measured using several outcomes. These include infection rate, length of stay, readmission rates, and adherence to clinical protocols. Monthly data tracking focuses on infection prevention, while quarterly evaluation focus on length of stay and readmission. And evaluators include neonatologists, APRN leaders, and the quality improvement team. These are my references. I hope you enjoy it. Thank you.